Sunday evening ends, and tomorrow's calendar already looks like a sprint with no recovery in sight. Years can pass in that rhythm, with health eroding in small, barely noticeable steps. The danger for most adults is not a sudden accident, but rather a slow progression of chronic processes. Modern care often reacts late, as it is rewarded for procedures rather than long-term prevention. When prevention is delayed, people can live longer but still spend many years limited by frailty or dementia. These late years can be financially costly, but the bigger loss is reduced freedom and capability. A normal checkup shows acceptable numbers, so habits stay the same until a diagnosis forces urgent change. By then, the timeline is compressed, and options often focus on managing disease rather than avoiding it. Next, we will map the major chronic threats and the few levers that most reliably extend health span. This video is inspired by Outlive by Attia and Bill Gifford. Subscribe to learn tools that protect health span for decades. Most of the danger comes from slow death, where disease develops for decades before symptoms become obvious. The major drivers are heart disease, cancer, neurodegenerative decline, and type 2 diabetes with metabolic dysfunction. Longevity is not only about living to an older age, it is about maintaining physical and mental function. Health span refers to the years when capability remains high enough to move, think, and live independently. If function declines early, the final years can become a long period of medical visits, limitations, and lost roles. That is why a useful question is, what is the trajectory of your health over the next 30 years? A person can appear fine in midlife while risks are accumulating beneath the surface, especially in metabolism and arteries. Waiting for obvious illness means starting too late, as the upstream process has already been running for years. A better plan is to treat prevention like steering, measuring risk early, and acting before the 4 chronic killers take hold. This shift reframes success as staying capable, not just surviving, so daily training and monitoring become worthwhile habits. Short trials and 10-year risk scores can miss diseases that take decades to develop inside arteries. A longer lens treats the body like a ship near an ice field, where early course corrections avoid disaster later. Medicine 3.0 is a prevention model that looks 30 or 40 years ahead instead of waiting for symptoms. It asks which hazards are closest, which are larger over the horizon, and how today's choices change that map. This approach also changes the patient role, because participation matters more than passive acceptance of late interventions. You become the captain, learning enough to set goals, understand risk, and change habits when needed. For heart disease, a key causal target is ApoB, a blood marker tied to particle exposure over time. ApoB includes particles like LDL and VLDL, and lowering exposure earlier compounds protection across decades. Instead of asking only whether the next 10 years look safe, the better question is what long-term curve you are on. That longer curve guides earlier screening, earlier treatment when appropriate, and earlier lifestyle work that prevents compounding damage. Exercise can be optimized for longevity by training multiple qualities rather than choosing only cardio or only lifting. The core dimensions are aerobic endurance, muscular strength, and stability, each supporting function as you age. Improving these traits help delay chronic disease and death while keeping daily tasks possible in later decades. Without injury resistance, fitness gains can collapse after one fall, one back flare, or one joint problem. Aiming for capability at 100 forces, training choices that also make 50 and 70 feel easier. The idea is to become an athlete of life. Pretty good at many movements, not perfect at one sport. Steady Zone 2, work builds a foundation, and maximal aerobic efforts raise VO2 max, a marker linked to longevity. Strength work builds muscle, but stability determines whether force moves safely through the body without joints taking damage. Start by choosing weekly sessions for endurance, strength, and stability, then track progress in capability, not just weight. If training for lifelong capability matters, subscribe to follow clear workouts and testing ideas that keep future function measurable. Nutrition works best when treated as biochemistry, not ideology, because food molecules interact with metabolism in complex ways. Nutrition 3.0 is a personalized approach driven by feedback and data, focused on what works and what you can sustain. 3 diagnostic questions guide decisions. Are you undernourished or overnourished? undermuscled or adequately muscled, and metabolically healthy or not. Poor metabolic health often comes with too much energy intake and too little lean mass, which raises the risk for type 2 diabetes. For many, the practical move is to reduce calories while increasing protein, paired with proper exercise to add lean mass. Any eating plan that compromises muscle is a non-starter, because muscle mass is a crucial determinant of lifespan and health span. Nutrition can restore metabolic equilibrium and reduce chronic disease risk, but it does not replace training as the main driver. Tactics used to correct obesity or type 2 diabetes may differ from those meant to maintain good health in stable individuals. Begin by defining the problem you are solving, then measure outcomes like muscle, glucose, and energy levels over weeks. Personalize food choices until you can stick to them, because consistency beats short-lived rules that break under stress. Sleep quality is crucial for brain health, as deep sleep and REM cycles support cognitive function throughout aging. Disturbed sleep can precede cognitive decline, making it essential to prioritize sleep improvement as a core part of prevention, not an afterthought. Sleep deprivation consistently increases insulin resistance, which can lead to type 2 diabetes and related health issues. Stress and poor sleep reinforce each other, with cortisol raising overnight glucose levels while limiting glucose use in muscles. In older adults, insomnia is common, and sleep disturbances often appear years before dementia is diagnosed. Addressing sleep disturbances may delay mild cognitive impairment by about 11 years, highlighting the importance of early action. Emotional health encompasses more than mental illness, including the regulation of emotions and the management of relationships over time. Caring for emotional health requires long-term prevention, recognizing problems early, and working on them consistently. Establish sleep rituals, screen for apnea when necessary, and maintain a calm evening routine to protect deep sleep and consistency. Pair these practices with deliberate relationship work, honest reflection, and support systems, as health span includes connection and joy. The goal is not merely to add years, but to steer toward decades with strength, clarity, and independence. Slow death can be confronted by treating risk as something to manage early, rather than enduring it later. Begin with the 4 chronic killers, then define health span as the function you wish to preserve. View health through a Medicine 3.0 lens, measuring long-term risk and targeting causes like ApoB exposure while there is time. Train endurance, strength, and stability, so the body can perform hard tasks without injury as it ages. Pair this with nutrition 3.0, aiming for metabolic health and enough protein to maintain muscle and resilience. Protect sleep and emotional health, as poor sleep raises insulin resistance and strained relationships can erode motivation. Choose one measurement to start, such as VO2 max testing, fasting labs, or a simple sleep score tracked weekly. Then adjust with patience, making small course corrections early to move the long arc away from disease. If this prevention mindset feels actionable, subscribe to keep learning how to steer health risks before they become diagnoses.